Good afternoon and welcome, everyone. Thank you so much for joining us and being part of this live conversation around the healthcare crisis that we're facing in Ontario. And before I begin today, I'd just like to acknowledge that I'm speaking to you from my home in Guelph. And Guelph is the traditional lands of the Haudenosaunee, the Anishinaabe, and the Adirondack peoples, and is currently the Treaty 3 lands of the Mississaugas of the Credit First Nation. And I just want to reaffirm my personal and our party's commitment to the truth and reconciliation process. And I think, especially after the events of last week with the papal visit, a real opportunity for Canadians to reflect on the truths of our pasts and the actions we need to take moving forward to heal our relationships with each other. Today, I'm proud and quite honored to be joined by a very highly respected and well-regarded family doctor here in Guelph, Dr. Courtney Bell. She's a strong believer in preventative medicine, and Dr. Bell holds an honors degree in biological science from the University of Guelph, her MD from McMaster University, and she completed her residency in family medicine at Queen's University. She returned to Guelph in 2009 to start her full-time medical practice. And in addition to her own practice, Dr. Bell is the vice president of the Wellington County Medical Society, and she is, in her own words, attempting to raise two well-rounded members of society while not losing her mind. And so I think every parent, especially coming through the COVID pandemic, can probably relate to that statement. So Dr. Bell, thank you so much for joining us. And I'll just say to everyone who's tuning in, it's interesting. I met with the relatively new president of the Ontario Medical Association earlier today, as well as the OMA representative for Guelph. And we had an excellent conversation about the OMA's 4-point plan to help address the healthcare crisis in the province. And I'd mentioned to both of them that Dr. Bell and I would be doing today's event, and both were very excited because I think it is so important in this critical moment in time that the public hear firsthand from healthcare providers just some of the personal stories and experiences that healthcare providers, doctors, nurses, and other healthcare workers are experiencing in their day-to-day work, and how the crisis within our healthcare system is really affecting their patients. And Dr. Bell had kindly reached out to me a few weeks ago to express her frustration and to share some of the stories with me that she's experienced and her patients are experiencing. And so I thought this would be a great opportunity for the public to have a better understanding of what our healthcare system, the challenges the system's facing right now, and to raise more public awareness. And obviously, we scheduled doing this prior to last weekend's closure of a number of ERs across the province. And so I think the timing of today's conversation is particularly important, especially as we gear up to go back to Queen's Park on next Monday, August 8th. And so, Dr. Bell, thank you so much for taking the time. I know you have an incredibly busy schedule, and I know you're very dedicated to serving your patients. And I think when we last met, you've decided that part of serving those patients may be doing a little public advocacy work as well. So thank you for taking the time to do that. And I was hoping to maybe just open the conversation with just a general question, just what you're seeing, what you're experiencing on the ground, if around the challenges that healthcare providers and patients are experiencing with our healthcare system from a family doctor's perspective, and to maybe share a couple of the stories that you shared with me that just sort of highlight and maybe personalize some of the challenges you're facing and seeing in your practice.
That is a very big question. that can be all encompassing. And I could probably take an hour to go over everything in detail. But I will say first, thank you for also taking the time. I am not normally a politically activist, or I usually just sort of come to work, do my thing, but it's gotten to a point where I really was like, I don't know what to do anymore. I don't think that I can sustain what's happening. I don't think patients can sustain what's happening. I don't think that the healthcare can sustain what's happening. And so hence why I reached out to you as like maybe you can help. And so, yeah, I'm happy to talk and share and tell as many people the crazy stories that are happening. Because I will tell you that before COVID, I call that BC, before COVID, I would have described our healthcare system as already breaking. And then throughout COVID, it's now just crumbling around us. And, you know, when COVID first started, it was like, flatten the curve. We don't have the capacity, flatten the curve. We don't have the capacity. And we're all like locking in and trying to flatten this curve because we don't have the capacity. But now we are years into this. And as far as I can tell from my day-to-day life, there's been no change in capacity. In fact, I would say we have less capacity. So I'm not really sure what has been happening from an administrative top-down approach, how our healthcare system works, right? Money funnels down, but there's been no increase in capacity. And so COVID delays and doctor shortages, and it's just like everything is just up in smoke and flames right now. And it is a crisis. It's a crisis on an individual, like it is like a crisis individually as a physician, and it's a crisis for patients. And I don't think that, like, I think people know, like, I think if you ask anybody on the street, hey, do you know that there's like a healthcare crisis? They'll be like, yeah, sure, I know. But then when you actually are the one who needs the healthcare, or you're in a medical crisis or a healthcare crisis yourself, is when it like smacks you in the face. And so it's smacking me in the face every day, which is why I'm like, somebody needs to do something. And I wish that I had a policy solution for anybody. I do not at all. But I'm hoping that people will be pushing our government to make some pretty significant changes, or to figure out a way to fix it, so that we all get the help that we need when we need it. Some of the stories, like the main concern, why I was like, I need to talk to Mike Schreiner, was regarding mental health. If I had to pick one area of medicine that is in the biggest state of crisis, I would pick mental health. But it's not just that. So I have stories on all fronts of any specialist that you might need to see, and how ridiculous the wait times are, and stories of people going to the merge and needing to leave because they just can't wait any longer, and all of those things. But the mental health situation is really appalling. I can't even think of a different word. And again, dating back to before COVID, like I think I told you, Mike, a story of a 19-year-old patient who I had, who had psychosis, like delusions, like they are literally detached from reality. And I referred that person in June of 2019, so before COVID. I didn't get notified until July 2021, like a note back from the Canadian Mental Health Association. Do you still need this referral? Yeah, the person still has psychosis. Like they're still waiting, right? And it's like, it's just is ridiculousness, right? Like that amount of time for somebody who's like not functioning. They cannot function in society because they're detached from reality. And we've waited years to get them help. And, you know, throughout COVID, there was a time when I as a physician could not referral anybody, 0 referrals accepted to the Canadian Mental Health Association. Like full shutdown. Our wait time is too long. We cannot help you. Oh, okay. So like, what do we do then? Right. So if somebody comes in, they need urgent mental health, right? Help. I'm trying to help them. If I can't help them, if I need a specialist to help me, what else am I supposed to do? Right. So now I'm a GP who basically is needing to be a psychiatrist because I don't have a psychiatrist. Which, by the way, would be equivalent to if you had a heart attack and then you wanted me to like try and put a stent in your heart. Like just figure it out. No, I can't just figure it out. Like, we have specialists for things that us as GPs, if it's outside of our scope, that's why you have a specialist. So there was a few months where there was just no referrals accepted. Now we're in a phase of the Canadian Mental Health Association locally, and I'm only speaking for my local, I only have experience within our local community here of Guelph. Now they'll only take crisis. So if you're not sick enough, then you cannot be seen. So now we're waiting until people are sicker. So your family doctor has tried standard treatments, right? But now if you're not sick enough, you just have to keep waiting for me to keep trying until you get magically sick enough where now it is a crisis. So now they'll see you because you're sick enough. Again, the ridiculousness of waiting for somebody to become sicker. Again, the heart attack analogy. If I knew your cholesterol was high and you had hypertension, I'm not waiting for you to have a heart attack to treat your hypertension, I'm not waiting to prevent your heart attack, right? I'm going to try to prevent the heart attack from ever happening, right? Not in our mental health system. It's like you're going to wait till you're sick enough. And so it is distressing because I feel like patients aren't getting the care that they need. If I can't get your mental health under control and I need a psychiatrist's help, then that's what that's what I need to do. That's what, like, if I can't get your hypertension under control, I'm sending you to a specialist. If I can't treat you appropriately, that's why we have specialists. And there's just nobody to refer to. I can't even tell you how stressful and distressing it is. And then patients, I keep seeing them in follow-up and it's like, when am I going to see a psychiatrist? When am I going to see a psychiatrist? I'm like, I don't know. There's, one specific story that the amount of time and effort that it took for me to literally fight to have this child seen by a psychiatrist is so upsetting because it's a child. So I have a 10-year-old. By the way, I have the family's permission to discuss this story, even though I'm not going to tell anybody's names, but 10-year-old who has a complicated medical history, autism spectrum, ADHD, generalized anxiety, learning disability, like lots of things going on in a little person. And this little person was previously followed by the Canadian Mental Health Association and was stable and life was going great because she got the help that she needed. And then they said, you're good. Go see Dr. Bell. She'll keep renewing your medicine for you, which no problem. I can renew medicine. I'm on it. But she started to decompensate, right? She started to not become okay. And she was starting to feel like life wasn't worth living. Alarming. You're 10. There's lots to live for. You're 10. And so I was like, we need to refer her back to a psychiatrist because if she was an adult, I might want to put her on an antipsychotic. I'm not putting in any child on an antipsychotic. That is outside of the realm of a family doctor. So I referred back to the CMHA. They said she wasn't sick enough, even though she was already seen by them, followed by them for years. She's not sick enough to see again. So I referred to a psychiatrist in the community. She's too sick. She's too complicated for the community-based psychiatrist. She needs to see the CMHA. So then I call the local psychiatrist to be like, I've already tried that. They won't see her. Sorry, we can't help you. So I can't refer either. And so now you're still just stuck with me. Sorry about your luck. You're stuck with me. So then I call the CMHA and I don't yell, but I speak firmly. And I say, this is ridiculous. She was followed by you. She's sick. She's too sick to be seen over here. What am I supposed to do? Well, Dr. Bell, you can talk to the psychiatrist and you can discuss her medicines with a psychiatrist. Oh, okay. So now I'm going to have a 30-minute conversation with a psychiatrist to try to learn how to be a child psychiatrist. The ridiculous of that is also not lost on me. So we're now, instead of the psychiatrist spending 30 minutes talking to a patient, she's going to talk to me to try to teach me how to become a child psychiatrist in 30 minutes. Okay, if that's all you can offer me, fine. So I wait and I talk to the psychiatrist. I don't know how long I waited, but a few weeks later, I talked to the psychiatrist. The psychiatrist says she needs to see a psychiatrist. Like, yes, I know. Thank you. But we still go over the consult. She gives me some medication suggestions. And in the end, that psychiatrist, only because I'm like, please help us, decides to see the child, which is what needed to happen in the beginning. But it took multiple phone calls. It took me pointing out the ridiculousness of the whole thing. And finally, this patient got seen, but like not every doctor has time or energy or the capacity to do this for every single patient. And like, I am a patient advocate and I will fight for patients, but I am also running dry, right? Like it's just so much effort, and it's just trying. It's hard to give that amount to every single thing that comes across my desk. And so
I think one of the things that, when we had spoke before that, and you brought this up today, is that you haven't seen an increase in capacity throughout COVID. And then I'm thinking, it just infuriates me that the government underspent their healthcare budget last year by $1.8 billion. And I'm thinking, so here we are, we don't have enough psychiatrists for you to be able to refer patients who desperately need to see a psychiatrist, but there aren't enough available. And yet we have $1.8 billion. Like, how many psychiatrists could be hired? How many additional nurses could be hired? How many specialist openings could happen? So you want to be going through this. And then I think, and I'd love your opinion on this, is it actually seems to me that would actually save us money in the long run anyway, because now by underspending, people are becoming more more ill, becoming more acute, needing even more service. That if we'd actually made the investment in expanding capacity in the first place, not only would your patients be able to have access to care, but it would probably be less expensive to care for them because their acuity wouldn't be far along as it is. And I'm just curious what your thoughts are as a family doctor, just that line of thinking.
100%. Waiting till people are in a complete crisis, cannot work, like are on social assistance because now I can't work. So now I'm on Ontario Works or I'm on ODSP, and waiting till people have deteriorated to the point of complete disability and where their lives are now at risk. Like, people die from depression, people die, right? That's what suicide is. People die from mental health, and waiting until somebody is like knocking at the door of that until you're getting them help is costing the system way more money. At one point, another story, a patient who had severe mental health, severely wanted to end their lives. I put them on what's called a Form 1. They were hospitalized against their will. They were admitted to Homewood for a long time. They needed what's called ECT, which is like electroshock therapy. Like, this person was very sick, and they got discharged, with no psychiatry follow-up. None. So my heart attack example, you just had a heart attack, you had a stent, and you got discharged with no cardiologist follow-up. You're like, I hope your heart is good. Bye. Okay. So this person, now follow up with your family doctor. That's like always like discharge summary. It's like, follow up with your family doctor. And you're like, okay. So I'm so confused why this person has no psychiatry follow-up that I call Homewood. Again, let's just take some more time than a Dr. Bell's tag. Like, I'm going to call Homewood and get a hold of the psychiatrist. The psychiatrist says, oh yes, it's a shame. I've never worked in a situation like this before where in this community, there's no psychiatry follow-up. Just keep an eye on the person. If they get sick enough and they want to end their life again, just send them back to the emerge. Okay, that seems, again, not like the best solution here. Oh, because, and this is the person might also need a refresher of their ECT. So, spoiler alert, I don't offer electroshock therapy in my office. Not something a family doctor does. So you have a specialist who's saying this person might need this procedure, this treatment again, But they're not going to be able to access it unless they want to end their lives and need to be back in the emerge. So talk about a system that's like, so now you're paying for like another emerge visit, another crisis day in a hospital, like instead of following this person, and if they started to get sicker, like maybe we don't have to go back into the hospital and back through emerge, and all of the, like that whole process can be avoided, but there's no capacity, right? The psychiatrists are like, well, you're no longer acutely sick, so I can't see you, I can't follow you.
Yeah, I mean, it's so sad how underfunded, particularly mental health is. And, it's one of the reasons I know in the recent election campaign, we were strongly advocating for, an immediate 8% increase in the base budget for community mental health services and increasing the mental health budget to at least 10% of the healthcare budget, because we just have such a big lack of capacity. And I think one of the things that really hit me is sometimes, and you said to me, the stats, Mike, I know the reality of people's lives, the fact that we have 18,000 young people on a wait list to access mental health services right now, and the average wait time is 18 months, sometimes as long as 2 years. And then sadly, you gave an example of somebody who's on that 2-year wait list. Like, what kind of pressure, so to get beyond the statistics, but like what kind of pressure does that put on you as a family doctor to try to manage? And what's it mean for your patients as they try to manage those wait times?
So the pressure is immense on GPs, because when people are waiting to see the psychiatrist and they're in crisis, they're in distress, and their options are either go wait 8 hours in the emerge for arguably nothing, like you're potentially might be able to see a psychiatrist, maybe not, maybe you'll see a social worker who will do an intake and be like, oh, right, and the emerge discharge will always say follow up with your family doctor too. So people are calling me and making appointments with me regularly in hopes that I can help them, and I try, but it's like frequent appointments of like, even like today I just saw a patient again where it's like, we're waiting to see a psychiatrist, these are okay, let's try this medication, we've tried like 4 or 5 different things, and it's like he's feeling distressed, and that things aren't, there's like nothing's working, and right, and I'm feeling distressed because I'm like, I wish I could help you, and I wish that I could get the psychiatrist appointment happening, but while we're waiting, try this and then come back, right? And then they're coming back to like, so it's always falling onto the laps of a GP. It's always like, when all else fails, if I can't get a hold of anybody else, they know that they can get a hold of a GP, which, side note, we also need more GPs.
Yeah.
So like my poor admin gets calls on the daily. Is Dr. Bell accepting patients? Is Dr. Bell accepting patients? Anybody watching this know that I am not accepting patients. But there's a need for GPs, because we're like people's like first line of defense. Like, I need basic mental health care, or basic preventative care, or basic health care should be accessed through a primary care physician, like through a family doctor, like your vaccines, like just routine healthcare stuff, right? It's like, we are the ones who should be accessible because we see you for acute things and chronic things and screening things, and right. But because we're so accessible for stuff that if like they can't get seen by a specialist, or they went to the emerge and then left without being seen, so now they still want to see somebody. So now I'm going to fit them into my already busy schedule because, oh man, like I see you were in the emerge yesterday and nothing really happened because you left without being seen, right? And so it all does fall, it falls back onto my lap, right? And the other big trend that's coming from psychiatry that is adding stress and making it difficult to breathe is that this like no psychiatry follow-up, but here's a list of things that you as the GP can do, right? So, my patient finally saw the psychiatrist, and you're like, thank God, like you're finally going to see a psychiatrist. We've waited and waited, right? And the psychiatrist sends me a list of 20 things to consider doing, trying, looking into. And at the end, it's like, I can't follow up with this person. So Dr. Bell can try all of these. Literally, the list was 20 things long. And it's everything from like, this person has such severe OCD that I think they should see an OCD specialist that works at a Sunnybrook. Here's that person's name. Here's this specialized clinic that me as a family doctor has never heard of, that this person should consider going to. Here's the link to do that. I'm like, I'm sorry, are you not a doctor who can do these things for this patient? But it's like, everything slides back down to the GP. Follow up with your family doctor. I've made some suggestions. It's only 20 things for one patient. Imagine every patient had 20 things that I needed to follow up on and figure out how to refer them to some specialist I've never heard of in a different city. Like, it becomes overwhelming because you're like, oh my gosh, how are we gonna do all that? Like, right? Like, it's just, we have so many patients and everybody needs something. We're trying to help everybody and we're trying to give everybody the best care possible. And it's like, you worry that like things are going to fall through the cracks. Things are going to get missed because maybe I didn't see number 17 on the list, right? Or I skimmed past it. Oh, wait, I should have also done this. So it's overwhelming, to say the least.
Yeah, one of the things I've noticed, and I've increasing number of constituents reaching out to me with complaints and very valid complaints about wait times, particularly, seeing a specialist at mental health care, accessing the mental health care system is just so under-resourced. But emergency room, I mean, it's just everywhere. The one thing that most people say to me is that when they're able to access care, it's actually good care. So whether it's family doctor, psychiatrist, therapist, nurse, personal support worker, lab technician, it's just people say when they're actually able to access people who work within our healthcare system, it's a positive experience. But it seems like the problem is there just isn't enough people, literally not enough people to care for people in our community to provide the care that patients need. And it sounds like a lot of what you're experiencing in your own practice, and I probably generalize to a lot of family doctors going through the similar thing, that it's just a lack of investment in the people who provide care and making sure there are enough of those people there to provide the care that people need.
I can confidently say that we have excellent trained physicians and nurses and counselors, and like the groups, like, the cognitive behavioral therapy groups or the DBT groups or the, like, all of the resources, if you can get them, are great. They're absolutely great. And the people are great. But there's just not enough people. There's not enough people. There's not enough access to those different programs. It just isn't enough. And, I know from when I was in residency that there's only so many resident spots, right? So like the government dictates how many psychiatrists we can produce or how many dermatologists we can have. Like there's like these like resident spots that are like restricted based on the government. And it's like, well, like is the only way to get more psychiatrists, like starting more spots, like can more people be made into psychiatrists, right? Or like, and like those are like the questions of like, how do we get more good people to fill those roles that so desperately need to be filled? Like, it's literally desperate.
So I'm going to ask you a question. If you feel uncomfortable answering it, by all means say, because I try not to make these conversations political, but this one I just can't help. So, the other day the Premier said we're throwing everything at this problem that we can. We're spending everything we can spend. We're doing everything that's humanely possible to address the crisis in our healthcare system. And I'm watching the press conference and thinking, but you just underspent your healthcare budget by $1.8 billion. And, I'm talking to doctors and nurses and, psychologists and, psychotherapists and healthcare administrators, hospital administrators all of them are saying we need more capacity and more resources. And so I guess as a, on the front lines family doctor, when you see the FAO, Financial Accountability Officer of Ontario report come out and say, hey, we underspent by $1.8 billion, like how does it make you feel? Given how, the struggles you're experiencing with your patients?
Yeah. So first of all, you can ask me anything. So I will probably answer any question you ask me. And it makes me angry. It makes me angry because I think that it's easy to give lip service to say, yeah, we're doing everything. Like, what is everything, right? To me, that sounds like a bit of what I would say is an overgeneralization. Everything? You're doing everything that you can? Like, no, you might be doing some things, but you're not doing everything because the system's still literally burning around us. Like, it is crumbling around us. And so the fact that anybody would say we're doing everything, I would immediately point out it's an overgeneralization. And if they did some CBT, they would learn that too. But anyways, it's frustrating, and it's hard to not feel disheartened. It's hard to keep finding the strength to keep fighting, to keep doing what we need to for our patients. Like, it's because you're just like, oh my gosh, like, is there an end to this? Like, is there a fix to it? Like, you have to believe that there is, because it's way too hopeless and sad to think that there isn't. But it makes me angry, and it makes me sad, and it's frustrating, and it's just not true. Like, it's not true. Like, I mean, don't ask me how our government works, or even how, like, the top down. Like, I've worked in healthcare. I've been a doctor for, I think, 13 years. And like, I don't understand how the system works. I'm just like a little person at the end of it who's like trying to help people. But I think that you don't even need to know how it works to know that they're not doing everything, especially if you have all this extra money you decided not to spend. I can guarantee you, I could have found, if you called me, I would have given you a few options of where you could have spent that money, like increasing a few programs for patients who need cognitive behavioral therapy, or increasing spots for people to become psychiatrists, or even GPs. Like, please make more GPs. But anyways, like, there's so many places where money, not that it's a fix-all, right? But like, there's so many places that can use more resources. Like, during COVID, like at one point, like our ORs in Guelph here weren't running, not because of COVID, but because there was no nurses. There's no nurses to run the ORs. So there's no ORs for no other reason than staff. There's no staff. So yeah, it's a bit of a situation, Mike.
Well, I know our time is coming to an end, and Dr. Bell, and I just appreciate you taking the time. I know you have a reputation in the community as being a fierce advocate for your patients, and I appreciate you just taking the time today to share some of the stories that you're experiencing, and I guess just to have the courage to honestly talk about how it affects you personally, because I'm hoping that as more people in the general public understand the challenges that healthcare providers, whether nurses, doctors, psychiatrists, healthcare administrators, PSWs, I mean, the list goes on and on. Like your personal challenges affects quality of care as well, right? And that we have to, I think, make the investments. And you're right, money doesn't solve all problems, but we have to increase capacity. And hearing your stories and your personal experiences, I think, is a valuable part of the conversation. So thank you for taking the time. I really appreciate it.
Yeah, and thank you for opening the conversation too, because it definitely needs to be talked about. So thank you.
Great. And just so you know, like I said, I met with OMA folks this morning, and you have some very strong advocates there as well. And so I think we just all, I think as a province, we all need to decide that, publicly funded, publicly delivered healthcare is a high priority, and we need to make the investments in making sure the system has the capacity to deliver the care that people need, and to make sure that the people who provide that care are taken care of as well. So thank you.
Thanks, Mike.
And thanks everyone for joining us, and please be safe. Have a great day. And we'll join you sometime in the near future with another one of these events, and keep your eyes open because Queen's Park restarts on Monday, August 8th. And I guarantee you that the discussions around what the solutions that need to be delivered for our healthcare system will be front and center of the conversations I bring forward to Queen's Park.